Anybody can have any idea? Sumiran, Mary.
Sir, official decisions or plans जो गवर्नमेंट बनाती है टू इम्प्रूव द हेल्थ ऑफ पॉपुलेशन, जो भी गवर्नमेंट मतलब सोसाइटी या पूरी पब्लिक के लिए पॉलिसीज बनाती है वो पब्लिक हेल्थ पॉलिसीज है, जैसे कि स्वच्छ भारत, आयुष्मान, नेशनल हेल्थ पॉलिसीज, जो ये सारी।
Hmm. Okay. हाँ ठीक है, पब्लिक हेल्थ है तो डेफिनेटली पब्लिक के लिए पॉलिसी बनेगी. दैट इज वेरी ट्रू. एंड व्हाट यू अंडरस्टैंड बाय द लेजिस्लेशन? व्हाट इज द लेजिस्लेशन? लेजिस्लेशन क्या है? एनीबॉडी हैज एनी आइडिया?
Sir,
एनी
laws,
एग्जांपल ऑफ?
legal rules.
हेलो.
Sir, laws
एनी?
and legal rules.
ओके. एनी एग्जांपल ऑफ दिस legislation?
Sir, food
Yes.
safety program, drug and cosmetic act, तो ये सारी जो।
Okay, yes. So there are two things which this particular subject covers. So one is the health policy and second one is the legislation. Okay. So first we this is our subject, that is the healthcare policy and the legislation. And today I will talk something about the what is the healthcare policy and few things about the national health policies and few legislation act also, not in detail because all these acts that will be covered into detail in the later on part. Today just we try to understand actually what is the policy, and this is the objective learning objective. So I hope कि after this completion of this chapter we can understand what is the healthcare policy and the legislation, and what is the role of the government in public health policy making, and various national health policies in India, and recognize the important laws. There are certain important laws which are affecting the public health also, Maternity Benefit and MTP Act, and how these different policies and the legislation act they are affecting the public health. So these are all the basically objective of the this particular subject, and after the completion of subject, I think you will be able to answer all these questions. So first we come to this healthcare policy. What is the policy actually? It's a kind of formal plan or guideline. Somebody has told that it's in order. It is basically created by the government or the institutions, and the purpose in the healthcare public health to improve the population health outcomes. Uh, in larger sense, this is the public health outcomes. But we talked about the population because it is going to be a huge number of the person in the community. And what may be the key elements of this healthcare policy when the policies are being made? What are the key things which are supposed to be addressed? One is the accessibility, equity, affordability, and the quality of care. These are the few things which you can think, or which you are supposed to be understand for any kind of public health policies. These are the few qualities which are supposed to be present in any kind of policy. Otherwise, policy is not going to address the purpose or the implementation. There are a lot of policies which were failed actually also. So one my question at this place is also there. In the tomorrow class or the day after tomorrow class, please tell a few public health policies which were failed. Everybody, I just request you just to go through that any public health policy, and particularly in the India, I'm not talking about the foreign and abroad and all that. There are few policies which were actually lacking all these kind of elements and they were failed. So all the students who were the part of this session, day after tomorrow, they should come with one policy in the India which was failed. due to various reasons. So what are the elements, important element already I told you, access. But whatever the policies is being made and what are the steps, what are the process in the policy that is supposed to be accessible by the all this person. And in healthcare, there are two words. One is the equality and one is the equity. So you have to understand what is the difference between the equality and what is the difference between the equity and what is the important in the uh, health, public health. Equality, यहाँ पे I use this word equity, but it is actually it is supposed to be equality. Equality means anybody can tell what is the difference between the equity and the equality. These are very specific kind of term in the public health. When you go into the field, you have to you are supposed to know these words, and when you get some chance to make some kind of policy, you must ensure these elements are supposed to be part of that policy. So just find out. And affordability. What is the affordability? But it should be easily, it can be afforded, or matlab, nobody should bear from his pocket and all that. Just if we talk about some yojana or some kind of policy, just if we talk about the JSY, Janani Shisu, JSSK, Janani Shisu Suraksha Karyakram, Janani Shisu program and all that, where the delivery and everything is being made free. They are free for the BPL patient or something like that. So for what purpose that particular element has been included? To just increase the affordability. And quality of care, it is also supposed to be present in all kind of healthcare. And in the public health, this quality of care may be sometimes it is neglected. So that's why if you see, if you have heard this, the NQAS and all that, which is actually the parallel part of, not parallel, but it is almost its job is same as with the NABH in the corporate or and the private hospital. The NQAS ensures the quality of care in this public health facilities, means health wellness centers, PSC,
Excuse me,
community
sir.
health
One
center.
student want to join. Let's check
Uh-huh.
your
Okay,
screen.
okay, okay, okay. Mm. Okay. I think everybody has joined right now. How many students you in the class? Just check me. Just let me check. Hmm. One, two, three, four. Okay. Okay. So that NQAS is the one thing, that is the national quality assurance standard, which ensures the quality care in these public health facilities, starting from the Ayushman Wellness Center to the district hospital. Okay. And sometimes medical college, they are also being the part for this quality accreditation and all. The quality of care is one thing which is also very important. And when you go into the field or you do something, its quality is not something which is different, which is in the isolation. When you are doing any process in a very logical and very efficient manner, quality is also automatically it is going to be the part of that particular system. So I want to take one example. Suppose if you are writing the prescription, it is very much clear. It is not done. What we are checking into the NQAS and the NABS, what are the things which are included in the prescription or not included in the prescription. But if you see from the doctor point of view, they are being taught in since initial, the prescription has supposed to be have the all demographic data of the patient. Prescription should have some summary of the his previous history, some important point of the his previous history. The prescription should have the present complaint. You have to write the mentioned duration and all that kind of things, and then you are supposed to write any provisional kind of diagnosis. Suppose some patient comes to you and he or she tells that there is a pain in the lower. lower abdomen, left or right, and it starts from the back and radiates to the front. Means you have written all these kind of complaint and all that kind of things, and then you can write what with your vision and wisdom, whatever you have got through your courses and the practices and all that. There is a chances of the ureteric stone or some kind of nephrotic kidney stone also. It may be there. So you have to mention just a provisional diagnosis as a ureteric stone, something like that, and that further can be confirmed. So means for the confirmation, you are supposed to also advise some kind of investigation. So that is also the part of the prescription. And then you have to give some medicines for the immediate relief with along with the dose and the days, and you have to also specify whether it should be taken as the previous meal and the after meal. And another thing which can be said, ki now we are talking about ki we should write the medicines in the generic name, so that can be the also can be ensured in the prescription. And then last part, you can always write ki in condition of such and such complaint, you are supposed to report to your nearest AMA, means authorized medical attendant, which can be a doctor. So these are all the basically the part of the prescription which has been told since the when somebody is graduating from this medical science and all that. So there is nothing like that. But all these parts they are converted into some quality check parameters or some kind of elements which we are checking in the NQAS as well as in the NABH also. So if you see, if you are writing the prescription, whatever I have given the brief summary of the prescription, there is no chance you are going to fail to comply with any kind of objective points or any kind of checking points of this NABH and the NQAS. So that is the importance of the quality of care. You must understand that quality is nothing in the isolation. Whatever we are doing, we should try to do it in a very effective manner, and we should try to do it in a very meticulous manner. So automatically, quality will be ensured. Okay. Then in policies, various things. What are the government? What is the government goals? What are the studies government is going to implement the policies? From where the fund is coming? A lot of yojanas, a lot of planning, a lot of policies are being implemented by the government. So we need the fund also. So from where this fund is going to become, and what is the implementation framework also? It is very important. At what level, at the Ayushman level, what may be the structure of that particular framework, कौन staff होगा, and which kind of facilities we are going to give. If we take some example, if I take example of this tuberculosis only, if we see at the health wellness center, we are only doing some kind of microscopic or some kind of sputum collection from the patient, and later on we send these samples to the higher some higher public health facilities, and they are going to check the all these samples and all that, and they give the report. So this is a particular framework of work at the Ayushman center. And if we send this sample to the CSC, community health center, or the district hospital, they are supposed to perform the CV naught. Okay. So that is the CV naught is the framework of the DH and the CH. It cannot be done at the PSC level or something like that, Ayushman center. So all
Yes,
these,
yes.
yes.
The your slides are not moving.
No, no, I am not moving my slide. I am it's still on the first slide. I am still on the first slide. I am just explaining. Okay. So these are the something which is a type of framework, and which is being decided by the government. Okay. Various example of the health policies, national health policies, 1983, 2017, 2002 also, universal health coverage. That is also a kind of policy. Okay. Now I change the slide. Are you able to make the appreciate the change? अभी स्लाइड मैंने चेंज किया
Yes, sir.
है. Anybody can please tell confirm whether the slide is changed or not at your end.
Sir, changed.
Okay.
Yes,
So
sir.
this is the actually I right now I just changed my slide. I come to this point. Then we talk about the healthcare legislation. What is the healthcare legislation? So it was also told by some student. It is the laws passed by the legislative bodies that regulate health system and protect individual rights. Protection of the individual right is very very important, and there are few examples which I have mentioned one is the medical termination of the pregnancy Act 1971, and there are a lot of modifications. There are a lot of rectification in the act till date. So if you go through this act, you will find there are provisions which are made to just protect the right of the pregnant women. Okay. So later on we will talk discuss in detail about this act. But at present, the part of the component of this legislation that I want to explain, that is the protection of the individual rights in any condition. If we talk about this PCPNDT Act, everybody knows this also protects the individual right. Okay, how it protects the individual right? Anybody can tell? कोई बताएगा?
Sir, question. I didn't heard properly.
Question is how this PCPNDT Act that protect individual rights. And it's some idea about this prenatal diagnostic techniques or not? Preconception and prenatal diagnostic techniques. Okay, this also protects the why this act was made by the government, why this act was enforced by the government, because they want to reduce the female feticide. That is one thing. Okay, once upon a time, there is a ratio of the male-female ratio in the India. It was very much disappropriate in the various states. Particularly, if you talk about the Haryana and the Rajasthan, male-female ratio was very, very distorted, and that was not a good sign for the health, healthy society, and all that. So these act actually protect the individual rights. Now, individual right means the person is the fetus, even that does not come into the world. Even we try to come, laws protect their life. You cannot do any kind of sex determination, and after the sex determination, you cannot go for any kind of MTP until unless it is not advised medically. You cannot go, just terminate the pregnancy just because of something like that. And same, this is the Factory Act. Again, this also protect the individual rights who work in the factories. They are supposed to be given proper rest. They are supposed to be given proper break. They are supposed to be given proper kind of remuneration at a particular time. All these kind of things. Same maternity benefit act. Mein there is a lot of you are supposed to get avail the antenatal leave. You are also supposed to get the postnatal leave. So these all acts they are ensuring actually protection of individual rights. That is why they are very important. Besides the policy, some act is these are passed by the legislative bodies, so they have the implications of the rules and laws. If you are violating this policy, you can be punished. But in case of in terms of the policies, if you are ignoring or you are just deviating from the health policy, then nothing like any punitive action can be taken against you. Okay. Some senior may tell you or some kind of so-called notice, something like things can be given, but no legally punitive action can be imposed on you. But when it comes to the legislation, all sorts of punitive punishment and financial punishment up to the imprisonment can be done. Okay, so that is the basically difference into this policy and the legislation. And why are the policies and laws important? Briefly, I told you this protects the individual right and all. But if we talk about and policy can be again, already I have told you why it is important. So policies and the laws and they are important because they ensure equitable access to health services, promote safety and the quality of care. Third one provides legal protection to the vulnerable group. Okay, support disease prevention and the health promotion. These are the very important point you can say for these policies. Maybe it is looking very no, a small point, but if I start elaborating, then I think 3 4 lectures may go on this elaboration of these 4 5 points. But one thing I just want to check from your side, Either you can give me a reply right now also, or you can give me the reply in the next class also. What is your understanding of this prevention and the health promotion? Disease prevention and the health promotion. With the example, I want to know how can you differentiate, how do you differentiate between these two, disease prevention and the health promotion? Anybody who is volunteer to give the reply at this point, the most welcome and most appreciated at this time. If anybody wants to give the reply, what is the disease prevention? How do you differentiate between the disease prevention and the promotion, health promotion? With the example, okay. Anybody can try.
Sir, the disease prevention is when there is a, we know there is specific disease like malaria going on, and how
Uh,
to prevent it. We have to prevent the growth of the flies and all. This is called prevention. And
uh,
the health promotion is to prevent that water should get collected in the area. That is called prevention or promotion in that way.
promotion,
To
and what is the
maintain
promotion?
cleanliness,
Uh,
I think the promotion will be to tell about the people to how to prevent malaria. Will that be promotion?
uh, uh,
Will that be
okay,
promotion?
okay. And prevention is doing the taking the
Prevention is
any.
taking precaution. You can say precaution in layman language.
Hmm.
Prevention means, sir, like we have to prevent collection of stagnant water. We have to prevent the growth of flies. This is how you call
Hmm.
prevention.
Hmm. Okay.
Yeah.
Anybody else who can try?
Sir, disease prevention, again, the actions taken to avoid any occurrence of disease और उसके
Uh,
रिस्कों को रिड्यूस करना, ये
uh,
सारे डिजीज प्रिवेंशन के अंदर आ जाएंगे, जिसमें लाइक प्रिवेंशन जैसे कि हेल्दी लाइफस्टाइल को वैक्सीनेशन, हेल्थ एजुकेशन, स्क्रीनिंग, बीपी, ये सब प्रिवेंशन के अंदर आ जाएंगे कि हम स्क्रीनिंग टेस्ट कर रहे हैं, बीपी शुगर की टेस्ट कर रहे हैं। और
uh,
हेल्थ प्रमोशन में कि ओवरऑल जैसे कि पॉलिसीज आ जाएंगे उसमें मेनली, जैसे कि टैबैको
uh,
को बैन करना, क्लीनिंग करना, वही स्वच्छ भारत अभियान, ये सब मतलब प्रमोट कर रहे हैं हम हेल्थ को, ताकि ये सारी उसी के अंदर आ जाएंगे सर।
okay. So prevention, matlab, it may be directly related with the actual problem. What is the problem existing? And promotion, it's a broader term. If in case ki malaria, it is because of the stagnation of water or some kind of dirty kind of environment or something like that. So promotion means we will also give focus on this neat environment, है ना? All these kind of thing. So there are two activities which can be which are being done simultaneously. Prevention, more or less, it is a kind of actionable steps, and promotion. There are various means of promotion you can do that. So this is entirely different kind of different type of different topic, because health promotion is very important in the public health. Sometimes if I get the chance to take some class on this health promotion, then I will take in the detail, slightly in more detail, ki what is the health promotion, how it is being done, what are the different kind of health promotion, how they are affecting the public health also. And same time you can also explore through various resources. But health promotion is peculiarly it is very important in the public health, and it is even, you can say it can reduce a lot of out of pocket expenditure from the general public and all that, if we start doing the health promotional activities and all. Okay. So you can explore in detail also in the various cases. You can take the example of the HIV, you can take the example of anything, and you just find out which is better way, or which is going to be most cost effective or cost benefit also in terms of the public health. So based on these economic evaluation also, we are accelerating the activities in terms of the prevention or the in terms of the promotion. So we have to, as a public health professional, we have to balance all these activities considering the cost effectiveness, and sometimes considering the cost benefit also. So we have to assess all these kind of things. So that is the later on when we talk about in detail how the policies are being made and all. Then we can talk about. Or I think there may be the separate subject also in the health economics, where all these thing that is the 1978 Almata USSR, they declared what they declared actually the existing gross inequalities in the status of health of people, particularly between developed and the developing countries, as well as within the countries, politically, socially, and economically unacceptable. Each and every word is very very important in this particular statement, and you can deliberate on this three four lines in a very very long manner. Okay, तो इसमें जो इम्पोर्टेंट चीज है विच इज यू हैव टू फोकस ऑन दैट कि एनी inequalities in the status of health of people, whether it may be the developed countries or the developing countries, it is not politically, it is not socially, and it is not economically acceptable. Means it is not beneficial for the country in any means, whether it may be economic part of time or social and all that kind of thing. And this emerged as a major milestone of the 20th century in the field of public health, and it identified primary healthcare as the key to the attainment of the goal of health for all around the globe. Basically, it's a concept दिया. This Alma Ata, they have given the concept of the primary healthcare, and primary healthcare is the one thing which can ensure this health for all or the universal health coverage kind of thing. So that is the main aim of this primary health care. That particular concept was given in this Almaita summit or the meeting. And what are the some salient point of this Alma Ata declaration? Health is a fundamental human right, and that the attainment of the highest possible level of health is the most important worldwide social goal. Okay, the existing gross inequality in the health is particularly between developed countries, politically, socially, and the economically acceptable, which has already been covered. Economic and the social development based on new international economic order is of the basic importance to fullest attainment of health for all. So these are few important point. The people have the right and duty to participate individually, collectively in the planning and the implementation of their health care. This line talks about the community participation. It is very important for making any policy for the community. You must involve the community people. Otherwise, that policy may be failed. If you are not taking the opinion and if you are not talking with the local people before the implementing of this particular thing, your very good policy they can just become the useless. So if you want to take the example, if you talk about some far flung very tribal areas where the people are very much orthodox, they are not coming to the health facilities for any kind of treatment, and for any kind of it, take the example of this institutional delivery and all that. So we have to think upon that. If we start, we open a good public health facilities, and we started giving good facility. We have posted one doctor, we have posted one pediatrician also there. Then there is no point to post them, because ultimately community people, because they're the beliefs and all that kind of thing, they're not going to move to your facility in that quantum which for which your facility is established. So you have to first, either you should be able to change the mindset of the local people, okay, they should come to you. Or if you see, okay, all these policies they're not going to implemented all of sudden. Initially level they are being tested as a pilot project kind of thing. When these policies are being have some kind of success stories or something like that, then government decide to implement the policies across the country. Okay, so initially you have to test some kind of pilot project, and then if you have to see whether that particular policy or something program they are going to be accepted by the local people, then you can put your all resources, or you can enhance your efforts to make that particular policy successful. Okay, so community participation is very very important in the public health. It's very important actually. आगे आने वाले लेक्चर में then I will let you know, because one of my paper I have published in this community participation in the in some Scopus Index Journal. So I published one my paper, and later on sometimes I will tell you what is the findings or the implementation of that research article. Government have the responsibility for the health of people. Okay, government should formulate national policies. All countries should cooperate in a spirit of partnership and service to ensure PSC for all people. जैसे अभी हमने देखा इन ड्यूरिंग द कोविड-19, everything just become global, means countries is they are just giving the were giving the vaccines to the other countries or something like that. So these kind of cooperation, global cooperation, and the coordination is very much required to acquire this primary health care or the universal health coverage or the health for all. So these are some important point. All countries they should cooperate. An acceptable level of health for all people by the year 2000 can attain through a further and better job, of course. This was basically the dream. Ki, by 2000 we are able to produce, we were able to create such kind of result. But if you see, even putting all the efforts and the resources, sometime it is not going to be happen what we think. So then we have to change some policies. Then we have to delete some point, or we have to add some point. And when we talk about this national health policy in the India, that is the example. Ki when the policy started in since 1983, and that policy actually was through and through for few years. And later on, because for all the policies, you are supposed to do the analysis also. Ki what is the impact of the policies? If they are not able to produce the desired result, then there is no point to continue that. Means either you need to change the policy, or sometimes we have to totally just disdain the policy. And that's why I asked one question to everybody. Please just find out for the next lecture, ki what are the, with any example, what are the public health policies which are failed in the India. And in detail you have to read about that, ki what were the reasons also. So that I want from all of you, you should at least we should be able to discuss two three policies. Then actually it is the fun of the reading this public health. Otherwise you just read the book, everything has been written in the book, and you just read the book and you can pass the examination. But believe me, when you come into the field, if you're not aware all these things, success rate is good. You know a lot of successful policies, but for understanding the what makes the success, you must understand ki why that was failed. If you understand ki why that policy was failed, you are better prepared to make a policy which where the success chances is more. So that is why you read this public health, something like that. You think upon that ki you are going to be, or you are a public health personnel, and you have to implement, you have to do something for the people of this country in a larger context. Then only you are able to give some kind of fruitful thing. Otherwise, if you want to read just for the examination or the passing of the examination or something like that, definitely you can pass the examination also, and you can top the examination also. But when you come into the field, then you may feel कि it was better if I could have read something, or if I could have learned something. So these are the few points for the discussion. In all lectures, I will do something like that. I am not going to teach you in a very very classroom kind of environment. Okay. And anytime you can also suggest me anything you want to know, है ना? So you can also ask me. There is nothing like I will able to give the reply. Also in the next lecture, I will try to fulfill your quench about the education and all that. Okay. So now we just discuss about this primary healthcare. What is the primary healthcare? The person, the student who are in this group who are from some kind of medical background or something like that, they understand what is the primary healthcare. It is an essential healthcare based on the practical, scientifically sound, socially acceptable. Again, you understand this word, socially acceptable method. This is a very, very important word. Bhang- Khatarnak, it's the most important word in the public health. If you're not able to make your policy socially acceptable, believe me, whatever the policies are there, it is going to be failed. So that is the thing. One important invention was then for the delivery lady, the lady who are in the delivery stage. So some invention was done in the India itself. Some innovative idea was created, and there is a kind of suit which was made. Okay, and by bearing that suit, a lot of complications were reduced after the delivery. But that suit was very good, and it was giving the result also. But it was failed, and failed reason because in the tribal area and the hilly areas, still ladies they are not believed to wear some kind of tracksuit or something kind of thing. So innovative idea was good, invention was good, but is what socially not acceptable. So that's why it has to be withdrawn. So a lot of things are being done by the in India also, but somehow all the innovative ideas and all the invention and all the steps, they are not going to be socially acceptable. So socially acceptable word is very, very important. So socially acceptable method and technology made universally accessible to individual and families in the community through their full participation. This is a very old definition, but now you see every word has been covered. Socially acceptable, community participation, which I told you, and at the cost community and the country can afford. Affordability factor is also included. Okay. And ASCII date may we talk about this universal health coverage. So there are actually three main components of for this universal health coverage. One is the affordability, second is the accessibility, and third one is the acceptability. These three things, they ensure the universal health coverage. If anything is disproportionate or anything is missing, it is very difficult to provide the universal health coverage or something like that. So these are the few words, USC, universal health coverage and all that. Initially, it seems it is a just word, but believe me, these all words are very, very specific. And if you understand, somebody can read about the universal health coverage also. And in the next lecture, we can discuss about this universal health coverage also. So they are very, very specific kind of thing. Okay. Now we just talk about some principles of the primary health care. First is the equitable distribution, community participation, intersectoral coordination, and this appropriate technology. At this place, I want to explain this. I want to explain this equitable distribution. There are two words I told you. One is the equity, and one is the equality. These two words, equity means when we talk about that, ki everybody, if somebody needs a very less medical health facilities, and somebody needs very high, matlab he needs more quantity, but as per policy we are providing the same kind of healthcare to the both individual. So that is the equitable, matlab that is the equity kind of thing. But actually healthcare facility को क्या होना चाहिए, that should be इक्वालिटी होनी चाहिए. इक्वालिटी मीन द पर्सन हु डिसाइड डेट मच ऑफ हेल्थ केयर, उसको उतना मिलना चाहिए. बट प्रैक्टिकली इट इज नॉट पॉसिबल. इफ यू टेक द एग्जांपल ऑफ दिस आयुष्मान भारत, इफ यू सी द आयुष्मान भारत that covers, that gives the coverage of this 5 lakh rupees family floater scheme, okay, for the BPL patient. But in amongst the BPL patient also, everybody has some different kind of financial position, but coverage is again 5 lakh. So we cannot say it is a good kind of thing. But if we see the larger aspect, because they have considered certain community, means a vulnerable group. कि बीपीएल होगा, ऐसा आदमी होगा, उसका इनकम इतना होगा. तो दे हैव ट्राइड टू डिसाइड, दे हैव ट्राइड टू make it in the equality form, but still there is some kind of you can say um, disproportion is there. That is a debatable issue, but there is no question of doubt कि आयुष्मान Jan Arogya Yojana is helping the poor people, and after this particular Yojana, a lot of out-of-pocket expenditure has been reduced, which was initially it was approx 60 to 70%, but now the out-of-pocket expenditure is approx 50 to 60%. So that is all because of this insurance, such kind of insurance scheme which are pro poor or pro vulnerable group. So that is very very much important. Otherwise, if we think about that, some mediocre middle class or the higher class, they are well covered with a lot of very lucrative health insurance scheme. But in public health, we should try to focus much more on the vulnerable group. And who are the vulnerable group? You can consider the people under the vulnerable group. जहाँ पे these three component, accessibility, affordability, and acceptability, these three components, if they are not matching, so that people becomes a vulnerable group. Okay. Now, if you take any example, you can justify in the framework of this. Okay. But then we talk about this community participation. Already, I have told you, need not to explain. Means for any making any kind of healthcare policy, you have to take the opinion of the community also, and to make ensure the public, the person, the student who are in the public health or who are working in some public health facilities, um, there are schemes which are Rogi Kalyan Samiti, Jan Arogya Samiti. These are certain samitis which are for the community participants. जहाँ पे जो president होता है, who is the sarpanch of the village. Okay, and lot of the other village people, they are also the member of this particular committee. And why they are the part of that? Because they give some feedback and some requirement of the committee. Intersectoral coordination, health cannot work in the isolation. It needs, there are various stakeholders in the health also. One of the stakeholders may be the school, one of the municipality, one of the is the local private practitioners, one of the local transporter services also for sometimes using as the ambulance or transporting the healthcare material. So there are various sectors who are involved in providing this health to the public community. That intersectoral coordination is very important, and appropriate technology means what is the technology? Technology doesn't mean here it's only the technology, some machine or something like that. In healthcare, even the ideas, even the concept, even the some innovation, they're all considered under the technologies. Okay, some promotional activities that can also be considered the technology and all that. That is again a different kind of subject. If you heard this word, health technology assessment. So if you read something about the health technology assessment, then you will come to know what is the meaning of this appropriate technology. Okay. So these are the four important principles of the primary healthcare, and you must understand equitable distribution, community participation, and intersectoral coordination, and appropriate technology. And why these all basic things are important? When we move on to the study for this various kind of policies, we must know what is the actually aim of, what is the soul of these policies, and what are the important factors which I have covered in this initial part, whether they were present in the policies or not. And then you can easily understand why policies were not continued longer, some modification or some changes has been done. Okay. So today, I think if at this stage, I will just stop my this session, and in the next, we will, day after tomorrow, we will further continue about talk about this national health policies.